to look younger? Start by asking the right questions. The first thing to remember is that cosmetic procedures are still medical procedures.
Preparation is vital during every step of any cosmetic procedure, and so is the work after it's done to ensure proper recovery and lifestyle habits to optimize your health and healing. One of the very first questions that a patient should be asking their doctor is, what procedure is right for me?
Right. In other words, asking me about a specific procedure is probably not as important as asking me or telling me about the problem or the concern that you have, and allowing the doctor then to be able to shed some light on what's going on, the aging process, and the potential options that are available to the patient. So Mike, when I first had the opportunity to meet you, you had some specific concerns. Why don't you tell us a little bit about that?
My main concern was these wrinkles and the scar on my face. And that's when I asked you, what do you think? What needs to be done? And the first thing you said is this. This needs to come out a bit more for you to look more masculine. And automatically I was like, wow, let's do it.
I find that a lot of people come in with they're very, very hyper-focused or laser-focused on a specific area, and sometimes they lose the forest through the trees. It's kind of all you see when you see it, and that's why often just asking during your consultation, what do you think about that, will help the doctor to put it into balance and perspective, and give you maybe redirect you to another area that you didn't even see.
Another very important question is to get an accurate quote. What would this procedure cost? People have budgets and they need to be working within their budget.
And as a rule, most cosmetic procedures are not covered by your insurance and they're deemed elective. But although that's the case, we have a lot of spas or clinics or even gyms that offer cosmetic procedures that try to undercut and discount prices down so that they're very, very inexpensive. And one of the messages that I try to get out to my patients is that they need to be aware of these kind of places and know that oftentimes you get what you pay for, and it might be a big fat complication or a result that you weren't looking for.
And some of the other questions that a potential patient should be asking is about the preparation for a treatment.
Yeah, it's really, really important to get properly prepared for a treatment that you're undergoing, whether it's something injectable or even surgical. And every treatment usually has some very specific treatment guidelines that you need to follow very carefully in order to prepare for them so that you can have a safe, beautiful result.
It is all about meeting with you, understanding every little detail of what's going to occur to you, and then medically making sure that you are adhering to all the right things, as in, you need to get off of certain vitamins or, medications because of surgery. And I think all that leads up to getting psychologically ready.
We went through everything from regards to my blood work, any other medications I was on, if I had any severe illnesses or anything. Dr. Torgerson did an extensive review of my history. Even I did do blood work and I did do x-rays, I believe, and I sent those in, and he went over everything before we even went through the procedure. Nothing was done without going through every piece of details.
For me, obviously when you're going into surgery, there's some worry involved. And for me, what creates comfort is knowing what to expect before and after. And Dr. Torgerson was so thorough and great at setting my mind at ease by explaining to me what to expect. And of course, worst case scenario and best case scenario, and for me everything was really flawless and seamless and wonderful. But I need that. I needed that to feel comfortable going through with a surgery, which isn't something that you do every day. So, it's a big decision.
And one of the things that we offer at our clinic is the ability to do procedures with local anesthetic all the way up to full general anesthetics. And I always say we want to match the procedure with the best anesthetic experience, which is the safest anesthetic experience.
And he also likes to ask very funny questions, just as you're going under.